Dr. Alvarez, any recommendations on do's and don'ts before joint replacement surgery?
That's a great question. We'll go with the do's. Do have a support system with you and a ride to and from the facility. Most joint replacements nowadays are outpatient procedures or a one-night procedure. Therefore, you need to make sure you have a ride to and from the facility. Number two, have a positive attitude and also try to be as active as you can before the procedure. So a lot of patients are going to be given exercises or a prescription for therapy. So their muscles are used to moving around and they know what exercises to do after the surgery to get moving and also to get their healing done as quickly as possible. The don'ts, very important, not to smoke before the surgery. And we usually recommend no smoking for at least a month before the surgery. Smoking is associated with increased infection rates, increased wound healing problems, and actually increased pain. It's very important that patients not smoke before and after the surgery. Another important thing is not to be taking narcotic pain medications before the surgery. Patients that get used to narcotic pain medications, when we do the surgery and you need the pain medications to work, they won't work as well. The other thing is there's some studies showing increased infection rates in patients that are taking narcotic pain medications before surgery. So we strongly encourage patients not to take narcotic pain medications before the surgery. Another important thing is to have a good diet. Diabetics need to have their sugars under control to lower any risk of infection and also to increase the wound healing rate. A lot of surgeons will have a cutoff on a number called a hemoglobin A1C. It varies from surgeon to surgeon. My cutoff is 7.5. I want diabetics to have a hemoglobin A1C of 7.5 or less for surgery. And that's to encourage wound healing and decrease infection rates. The other important thing is to have an adequate protein intake. Protein is very important for healing, and there's studies showing patients that don't have enough protein in their diet have delayed wound healing and increased infection rates.